Hi, I'm Dr. Rainone, and I want to talk to you today about the most exciting thing that I think has come along in over a decade with regards to dermal fillers, or as you know them, Restylane, Juvederm, for example, as the brand names. And that is the Dermasculpt micro cannula. Now, the cool thing about this cannula is it has a blunt tip. Take a look at that. It's not piercing my finger. It's a soft, blunt tip, and also note the flexibility. We're not dealing with a stiff needle here. And here's a magnification of that. So you can see it's got a soft, rounded, blunt tip and then a little hole on the side for the filler to come out once it's under your skin. Why this is important and exciting is that we've been blindly putting very sharp needles under the skin to introduce filler. And that sharp needle point is hitting nerve endings, small vessels. When it hits a small vessel, we know what happens. The small vessel leaks and you get a bruise. A lot of people don't get fillers because they can't put up with the bruising and the recovery. So in essence, the needle was introducing all kinds of trauma under the skin that really isn't necessary when you can use a blunt cannula. Now, I'm not new to cannulas. I've used them for years for liposuction. That's on a much grander or larger level. Those are larger cannulas, but not very different in that they were being passed under the skin into the fat and not introducing trauma. The beauty of this in the face is, and why it's less painful and why it causes less bruising and less inflammation, is that as it finds its way under the skin